Hi, very good evening to everyone. I am Dietitian Soumyendu Ghosh from Kolkata. So I am practicing from last 18 years in Kolkata, and I am also working as a community nutritionist and associated with different organization. So I am happy to get my mentor also today, Babita ma'am, and a very renowned fitness expert, Hansraj ji. So today this program is brought to you by K-Link, and today we are discussing on a very important topic, and I think it is very new. We already have discussed many times on fatty acids, on omega-3, but chlorophyll is quite a new topic to us. So we all are living in a inflammatory world. From last 2 decades, if you see, we are very much influenced by the Western cultures. There are many foods which are already inflammatory, the white poison, as we say. We have disturbed sleeps. Everybody now we are going to sleeps like in the 2 a.m. In the midnight, or somebody late after that. We have different issues in posture, sitting every time we are in the whole day we are sitting in a chair. We do not have any movements. We are sedentary, and especially I will talk about the inflammations. That is, it is very important to have anti-inflammatory antioxidants diet. So what is the role of this green pigment, that is chlorophyll, which is for these, all the plants we see are very much green and fresh. So we will discuss these things from, we will get to know the research, the studies, what are being recently done on this. So first let us introduce our both the speakers. So Hansraj is a professional credential. He is Mr. Bengal. We can see Mr. Bengal champion. He is certified fitness trainer, specialist in fitness, physical conditioning, body transformations, chiropractitioners. That is very important right now. That is posture corrections, alignment, physical and well-being. He is also acupressure therapist, pain management, muscular recovery, focus on the mobility and recovery of the physical resilience. Nowadays also it is very important. Most of you know what is Reiki. So he is also a Reiki master, expert in relaxation, stress reductions, and also, he has many professional credentials, building strategies, relationship across the fitness, wellness, and entrepreneurial community. So great to know about Hansraj Chandalia ji. Apart from this, we have our clinical dietitian Babita ji Hazarika. She has served in Apollo more than 21 years as a HOD dietetics, Apollo Multi-Speciality Kolkata. She has more than 3 decades of experience. She is the master trainer in PG Diabetic Educator, IDF. Also, I was student of her in that course, certified in critical care nutrition, SPEN, Triple L course, trained in ketogenic diet, GPC, and many more. She has many publications. She is the member of many prestigious body, and she has been awarded and recognized as state winner excellence in medical nutrition therapy by IPN Quality Award 2021. So without any delay, I would like to invite our first speaker, Babita ma'am, and then Chandalia ji. Thank you.
Thank you, Soumyendu, for the introduction. I'll just share my slides.
Yeah.
Is it showing?
Yes, it is.
Is it showing? No.
It is showing.
Sorry.
Acha. Chandalia ji, please remove Babita ma'am from the co-host. Otherwise, it will be disturbing the people. She have to admit in the screen. So it is better to remove her from the. Oh, otherwise she will able to share if you remove her. Ma'am, you just go to.
No. If I remove her, she will not be able to.
Not be able to share. Ma'am, now you open your PPT, and whenever you are sharing the screen and share. Yes.
Is it getting? Yes. It's okay.
Yes. Now it is okay. You just make it full screen.
Okay.
Perfect.
Yes, sir.
Perfect. Okay. Good evening, everybody. It's a pleasure this evening to talk, to be in this forum and to talk on essential fatty acids, the benefits and the research that has been done, to which, really says that it is beneficial, and we shall talk more about omega-3 fatty acids. So first of all, the basics, we know what are fats, right? They are made up of the building blocks of the fatty acids, and this is true both from the food that we eat and the fat in our bodies, right? So fats, when we eat, it breaks down to fatty acids, and there are four types of fatty acids. We have the saturated ones, which raises the LDL. We have the monosaturated ones, which is called MUFA, which is a healthier fat. And we have the polyunsaturated fatty acids, which is called PUFA, which has got significant health benefits, which has already been vetted. And omega-3 and omega-6, they belong to this group of fatty acids. Then we have the trans fats, which we know that they are dangerous, okay, and they are rare in nature, but it is widely used in the processed food by adding hydrogen molecules, so that it becomes like it stays, the shelf life increases and it remains solid at room temperature. And these trans fats, they are generally unhealthy, and the FDA regulates the use of these food products. But here in India, we find that most of the bakery products, most of the cookies, they are filled with trans fats, right? And the American Heart Association, they limit the intake of saturated fats to 5 to 6% of the total calories, and trans fat should be less than 1%. So these essential fatty acids, okay, why are they called essential? Because we cannot prepare it, we cannot synthesize it on our own. So these must come through our diet. And these fatty acids, they play a critical role in various physiological function, including the cell membrane integrity, the hormone production, and the inflammatory response. So when we talk about the essential fatty acids, we shall talk about the omega-3 family, that is the alpha-linolenic acid. We have the hexagonic acid, we have the eicosapentaenoic acid, and as far as omega-6 family is concerned, we have the linoleic acid, we have the arachidonic acid, and we have the gamma-linolenic acid. So omega-3 fatty acids, after we consume, the omega-3 fatty acid is metabolically transformed into EPA and DHA. So ALA is broken down to EPA and DHA, which are more readily absorbed and the functional forms of omega-3 fatty acids for the body. So these alpha-linolenic acid is concerned as essential in the diet because it is a omega-3 building block of the fatty acids EPA and DHA, right? So ALA is important because it breaks down to EPA and DHA, which have got shown to have a lot of health benefits backed by science. So the role of omega-3 fatty acids, what does it do? It every cell in our body, the membrane, it is primarily made up of these fatty acids, right? And the membrane regulates the entry of essential nutrients into the cells and facilitates the swift removal of waste products. So the cell membrane has got a lot of role to play, and this cell membrane is primarily made up of these fatty acids. So the supporting robust cell membrane, for these processes to function, the cell membrane, it must preserve both its strength and it must also preserve the flexibility. So when the cell membranes are compromised, the cells, they struggle to retain water and the vital nutrients, right? So, and addition to that, they cannot communicate with the adjacent cells. So scientists suggest that impaired cell-to-cell communication is a key factor in the development of cancer's growth. This is particularly relevant in the context of breast cancer, where omega-3 fatty acids influence multiple biological pathways to help maintain the healthy cellular function. And the second is the prostaglandin production. So omega-3 fatty acids are crucial contributors to the synthesis of potent hormone like compounds which are known as prostaglandins. So these prostaglandins play a vital role in managing a wide range of bodily functions, like it regulates, like it controls the blood clotting. It facilitates the nerve signal transmission. It helps in regulating the blood pressure and also modulating inflammatory and allergic reaction. And in addition, the performance of the kidneys and the digestive system, they are assisted in the regulation of other hormone levels also. So the benefits of taking omega-3 fatty acids, that it may contribute to the prevention and in the management of Alzheimer, ADHD, bipolar disorder, cancer, cardiovascular diseases, depression, rheumatoid arthritis, eczema, hypertension, migraine, multiple sclerosis, atherosclerosis, osteoarthritis, osteoporosis, and psoriasis. So these fatty acids, as I have stated, they are the building blocks of cellular membrane, and they support the development on ongoing health of brain functions. And essential fatty acids are involved in creating hormone-like substances. They regulate the immune system and they control the inflammatory reactions. These fatty acids contribute significantly to cardiovascular wellness. Remember, there are a lot of studies which talk about benefits of these fatty acids in the cardiac health. And EPA lowers the triglyceride level, reduces blood pressure, as I had stated earlier, and also prevents clots by inhibiting thrombosis. So research study, they may also play in the role of decreasing the risk of certain cancers, especially breast cancer and colon cancer. So omega-3 fatty acids, it's as I had stated, it helps in to take care of inflammation. It increases the blood flow to the brain, which improves cognition and enhance both learning and memory. Omega-3 also reduces the risk of dementia, encourages neural preservation, and protects against neurodegeneration. It is associated with the small brain size. By contrast, omega-3 fats delay structural brain aging, okay, and they help to preserve the brain volume. This study also talks about omega-3 having a role to play in ADHD, then bipolar disorder, depression, etc. It also helps in taking care or to reduce anxiety and depression. So the strongest evidence of omega-3, that it decreases the triglycerides and it increases the HDL. So omega-3 can reduce very high triglyceride. The American Heart Association recommends 2 to 3 grams per day, okay, and the source of EPA and DHA for the people who have high TG levels. As far as the good cholesterol is concerned, clinical trials suggest that omega-3 raises HDL cholesterol levels in people who are at high risk of cardiovascular diseases. So the heart health is important, okay, where omega-3 plays a major role. Now, there are certain observational studies. So how is this omega-3? How do we know that omega-3 is important for our heart? Okay, this is because of it is backed by certain studies. So a pool of analysis of 13 prospective cohort studies, comprising of around more than 3 lakhs of individuals and 12,000 coronary heart disease events over follow-up of period of 5.3 to around 30 years, found higher LA intake to be associated with 15% lower risk of CHD events and 21% lower risk of CHD mortality. So the dose response it analyzed found that replacing 5% of the energy from saturated fats with LA was associated with 9% lower risk of coronary events and 13% lower from coronary deaths. So there is this study which talks about 2019, though it is around 8 years old. The 30 prospective cohort studies were there, taking into account of around 70,000 participants, found that individuals in the highest versus lowest quarantile of La concentration in tissues had 23% lower risk of cardiovascular mortality. Now let us look into how omega-3 fatty acids helps in the brain health. So omega-3 interventions are valuable, and omega-3 is well tolerated, and omega-3 is safe. According to studies, DHA is well tolerated and has a considerable favorable impact in the progressive memory loss, a serious health problem, especially among the elderly. Okay, and omega-3 supplementation increases the phospholipid levels in the brain, increase the neurotransmitter release, and improve cognition. The consumption of omega-3, it helped in learning, it helped in the memory ability, it helped in the proper blood flow towards the brain. And as I had said, omega-3 is well tolerated, and it has no risk as such. It has been observed that the people who are lonely, and especially the elderly, and people with less consumption of healthy foods containing omega-3 can benefit from the consumption of omega-3 supplements. So these days we see that the elderlies are mostly staying alone, okay, and the diet is also not rich in omega-3 benefits. Then taking omega-3 supplements are given advantage. So an high ALA intake was associated with 35 to 50% reduced incidence of stroke in a cohort study of 20,000 middle-aged people in Netherlands. The references are all given below from where it has been taken. Omega-3 also takes care of anxiety, and it takes care of depression. So there are lot of studies combating it. Letting us know the goodness about this in depression and anxiety. So the study suggests that the dosage of 2 grams of omega-3 per day or more could help in anxiety, to reduce the anxiety symptoms. Okay. People in the study who received less than this did not see the same effect. So this effect was seen, that depression and anxiety was diminished, okay, only when they took 2 grams of omega-3 per day. So there is a recent study of 2023 of 10 clinical trials showed that the supplements containing more than 60% of EPA appeared to reduce depression at a dose of 1 to 2 grams per day. Okay, but if EPA is taken around 2 grams per day, it did not show better benefits. Okay, so I think 1 to 2 grams should be the amount to get the best out of omega-3. There are certain trials. They looked at the very widely in the how it is carried out. So more trials that uses the same method are needed to be determined whether this effect holds. Okay. As I had said, omega-3 takes care of depression, especially see, we should take omega-3 as a prevention. Okay, once a patient goes into high level of dementia, then omega-3, it is not the medication to cure that, right? So before it starts, okay, so I think elderlies, okay, should be given omega-3 fatty acids. Okay, and Alzheimer's disease and dementia have a positive effect. Okay, and it is linked to memory loss, linked to aging. Okay, and it states that omega-3 should be given before the symptoms have come in. Omega-3 also takes care of inflammation. Inflammation contributes to the causes and severity of many diseases, including the heart disease, diabetes, cancer, brain condition, depression, and autoimmune diseases also. So reducing inflammation with ALA may improve these disease outcomes. This is a 4-week study that talks about ALA supplemented diet reduces the inflammatory markers like TNF alpha and interleukin 1 beta by 30% compared to a diet high in omega 6. Okay, in a study of 645 healthy volunteers. So here it talks about that omega 3 has a better is said to be better than taking omega 6 as far as inflammatory markers are concerned. So these ALA supplementation via maybe linseed oil or that is flaxseed oil also reduces inflammatory markers of 50 people with high cholesterol levels. High dose of ALA in a 12-week study of 60 older adults undergoing strength training reduces inflammation, that is interleukin 6, and invoke knee muscle strength compared to the placebo. So to the people who were going for these strength training, okay, they were more benefited by ALA because it reduced the pains and it increases the knee muscle strength. As far as the immune systems, the immune function is concerned, both omega-6 and omega-3 families are useful in human autoimmune inflammatory disorders. Okay, this is a research which was done in the University of Greenwich, okay, which found that omega-6 fatty acids help prevent or reduce the severity of autoimmune diseases by enhancing immune function and regulating cellular immune reaction. Omega-3 fatty acids also has, and even omega-6 fatty acids, it also has a role to play in cancer prevention. So there were 350 colon cancer patient and 350 controls. So the higher ALA levels in the blood was associated with reduced incidence of colon cancer by 57 and rectal cancer by 59%. This is a study on breast cancer patient, that patient with a higher amount of ALA. ALA, okay, it was 80% were less likely to experience metastasis. So the breast cancer patients who had a higher level of ALA, so metastasis was seen to be less by around 80%. So this is another, trial which shows that breast cancer patients and 123 patients with breast cancer and 59 healthy controls found that breast tissues with the highest level of ALA was 65% less likely to develop breast cancer. So flaxseed oil, it reduced the development, number, severity, and the size of skin cancer in mice. It also increased the antioxidant and improved the detoxification enzyme levels in the skin and liver tissues. In the laboratory, it was seen that ALA exposed reduces colon cancer and breast cancer cell spread and growth and increases the cancer cell death. So lab reports, speaking on the cancer cells and on the breast cancer cells and the colon cancer cell, that it increases the death of these cells. It has also got a role to play in diabetes. So ALA given as 1 gram of flaxseed oil daily improved wound healing. It reduced inflammation, increased insulin sensitivity, and reduced fasting insulin levels. So the storage of ALA in fat tissues are inversely related to insulin resistance in the study of 716 people. However, dietary ALA intake was also associated with reduced insulin resistance in people with BMI of under 25 or with similar waist or with smaller waist sizes in the study of around 3,500 people. ALA supplementation results in the improvement in insulin sensitivity and increase in the protein involved in metabolism, that is adenopectin, in a study of 20 patients with type 2 DM. Omega-3 has also got a role to play, or these essential fatty acids, they also have a role to play in the PCOD or the PCOS patients and appear to be more likely to develop diabetes with high insulin and glucose levels. So in a study of 60 women with PCOS, flaxseed supplementation, it lowered the insulin levels. Nowadays, we find that every third or fourth lady is suffering from PCOS, right? So I think this omega-3, the science talks that flaxseed oil, okay, supplementation, it lowers the insulin level, as insulin levels are usually high in PCOD and PCOS, and high, insulin levels are there, and also the glucose levels are high in these type of patients. As far as obesity is concerned, ALA reduces the intra-organ fat mass, the body weight, waist size, and blood triglycerides. So there was a similar study done that supplementation reduced, all these, the fat mass, the weight mass, the waist size, the body mass, and also the blood TG. So ALA activates gene involved in the fat breakdown, and it increases heat production in the gut, resulting in increased calorie burning. So by taking ALA, maybe the metabolism does also go up. So in mice, substituting ALA, that is corn oil, flax oil for corn oil in these diets decrease the fat mass in such animal studies. It has got a role to play in the skin health. We all take care of our skin by applying nothing from outside. I think the skin glow and the skin health actually comes from inside, right? Unless and until we eat right, okay, we are well hydrated. We will not be getting a healthy skin, and you forget about Korean skin. So this omega-3 and 6 are both necessary for skin health. They keep the skin elastic. It reduces the effect of ultraviolet rays, okay? And they also help the skin function as a barrier, keeping the moisture in and the irritants out, okay? So these fatty acids, okay, maybe because we know that if there is a deficiency of omega-3 fatty acids and even omega-6 fatty acids, then there is, symptoms of dry skin, or small pimples in the skin. So low ALA status is associated with dry and uncomfortable skin and poor skin quality. So flaxseed oil has a high ALA content, which supports skin health, and flax seeds decreases the skin cell inflammation, and it promotes regeneration. So this is a small study where supplementation improved the skin sensitivity, hydration, and overall condition. This is another study which shows that, which talks about reducing skin redness and roughness. And flaxseed also lowered skin cell inflammation and increased the skin cell repair. Omega-3, the another benefit of omega-3 is bone density, and human studies support a greater intake of polyunsaturated fatty acids, including omega-3 and 6, for higher bone mineral density and the reduced risk of fracture. So these fatty acids, it influences the bone cell metabolism. It helps to preserve the skeletal formation and may help to reduce the risk of osteoporosis and fracture. In reproductive health also, it is important because pregnant women need a good supply of omega-3 to ensure normal development of their babies. And these are especially important for the fetal development of the brain and the eyes. And these essential fatty acids may prevent depression, okay, during pregnancy, or also postpartum depression. So impaired reproductive health is a symptom of linoleic acid deficiency, because linoleic acid contains essential components of all cell membranes, as I had stated earlier, that can influence the productive process and alter the progression of prostaglandins. Plus, the reproductive system requires a high polyunsaturated fatty acid content to provide plasma membranes and the fluidity that is essential for fertilization. So brain health, it helps in better learning, memory, cognitive well-being, and brain blood flow. It has got a role to play also in infants, because omega-3 fatty acids, when the mother takes this, it is known to support the brain development in the growing fetus. Getting enough from your diet during pregnancy is the best way to meet this requirement. If not, then the lady or the to be mother needs to be supplemented, right? And this clinical trial also talks about that it may boost in cognitive development in the child, but more of research is to be done in this matter. Okay. And the author also noted that studies did not sufficiently represent certain populations in this study, such as those with lower economic status, adolescents, or people of different races and ethnicities. So more research is required to support omega-3 supplements in pregnancy, but ensuring that our diet is, having enough of omega-3, it is definitely going to help the baby's brain development. Asthma in children, it takes care of, helps in reducing asthma from indoor pollutants. So research suggests kids are better protected when they eat more foods with omega-3 and less dose of omega-6 like soybean and corn. Supplementation of omega-3 can, it helps to reduce the release of inflammatory substances from the individual suffering from asthma. As in brain development, I had already stated that it helps, if plenty of omega-3 while you're pregnant for the growing baby, it is good, it helps in the development and future thinking and reasoning skill of the child. In older adults, these are studies that talks about, that when people get older, they usually have, declined brain functions. So this study talks about omega-3 supplementation could be beneficial at the start of the Alzheimer's disease. Remember, I had stated earlier, if the elderly person is full blown as Alzheimer, then I don't think that omega-3 can be only used without medication, but let us be proactive in prescribing this to the elderly people. Okay. And omega-3 supplementation would be helpful in treating the disease once it has developed. So once the person goes into Alzheimer, the studies do not show much gain towards this, but it is before they have such problems. So this study again talked about omega-3 supplementation improve brain function in older adults with or without mild cognitive impairment. It could be worth boosting the intake of omega-3 as getting older to help prevent or lessen the cognitive decline among with other lifestyle factors that support the brain health. Now, omega-6 and omega-3, what should be the ratio? So these essential amino acids, they are vital, but remember there is a ratio. Okay. So the deficiency is if a deficiency is suspected, small dietary changes or professional, guidance can make a big difference. Okay. There has to be a right, balance between omega-6 and omega-3 in the diet is crucial for optimal health. While both are essential, excess of omega-6 fatty acids in comparison to omega-3 can promote inflammation and related health issues. Remember, these days we are prone to taking more amount of omega-6, especially from the oil that we are using for the cooking. Okay. So this omega-6 fatty acids, if it is taken in a large amount, then it is going to hamper our health. So we need to increase our omega-3 fatty acids from other food sources or from supplements. So our diet tends to be high in omega-6 and low in omega-3. And a low intake of omega-3 fatty acid compared to omega-6 may contribute to inflammation, chronic diseases such as also things like rheumatoid arthritis, diabetes, atherosclerosis, and heart failure. So this is what the study says. So striving for a balanced ratio can support overall health and reduce the risk of the chronic diseases. So I think we should think about it. We should read. There are a lot of papers which have, which are talked about, which talks about the goodness of this omega-3 fatty acids, and let's give the best to our people in our family and also to the public as a whole. Thank you, Soumyendu.
Thanks a lot, Babita ma'am, and it is a nice presentation. You have touched all the organs where omega-3 is very, very important, from skin to heart, brain to depression, everything. And it is very true that omega-6, omega-3 ratio we need to understand, because the oil or the nuts we are using unknowingly, maybe we are taking high amount of omega-6 and causing inflammation. So now I hand over the diet to Hansraj ji, Hansraj Chandalia.
Okay, thank you, Soumyendu sir. Very good evening to all ladies and gentlemen. And before starting this meeting, first of all, I would like to thank Babita ma'am for giving me the opportunity, and also Mr. Soumyendu for conducting such a wonderful meeting. So thank you very much. So before we commence and we start, we understand first this thing, why Babita ma'am is the mentor. Because she has shared so much of information regarding this omega-3 fatty acids, and really I also learned so many things about the new studies and all the from Babita ma'am. She is very kind and very helpful in nature, and the frequency she gives to everyone is like very adopting, right? So today my subject is to talk to you about the, as Mr. Soumyendu said, that we need to talk about the chlorophyll, right? So before starting this thing, first of all, I would like to welcome to my company, which is like K-Link. K means knowledge, and link is about linking with knowledge, right? So a person who is supposed to come and he should know about the different aspect of K-Link, like a person need health, a person need wealth, a person need freedom of time. So how he can get under one roof? That is the name of K-Link. So we started our journey in December 2000 from Malaysia, Kuala Lumpur. This is our headquarter in Malaysia, Kuala Lumpur. And from December 2000 till now, we have spread like more than 100 countries, and we came into India in 2002 in the month of May, and we started our operation in India. And now it's almost 24 years now. So we are running very successfully in every state. We are promoting this thing. Why? What is the concept? Why we become so successful? So the first thing, we follow this WHO guideline. Nowadays, the WHO says that healthiness is a state of well-being that covers three aspects: physical, mental, and social well-being. So if you say that I am physically fit and you are mentally and socially you are not fit, then also you are not a healthy person. So keeping that thing in mind and following only one person, which is, if you see, Dr. Linus Pauling, 2 times Nobel laureate, he has already stated that you can trace every sickness, every disease, and every ailment to toxins accumulations. Right? Basically, today my presentation would be like very simple. I am not going very scientific about these things because you guys are expert in that field, so you can easily understand. So, but the basic thing is this, that if you talk about any disease, which comes, the basic main reason for that is the toxin accumulation. We believe in this thing. So, if the toxin accumulates in our body, what does it do? If you see, there are 6 major factors that influence human health. One is air, water, nutrition, emotional factors, exercise, rest and relaxation. The most important where the body stands on is the air, water and food. If we talk about the air, water and food, so nowadays what we have done with the air is polluted. If you see, the AQI level of every state is in the danger zone. If we talk about the water day by day is losing its nutritional value. And if we talk about the fruits and vegetables, so many, everything is now being used by the, now is being grown by the chemical fertilizer. So many of things. And every drugs have its own side effect. We all know that. And from morning to night, so many of chemical products we use every day, just to look good outside, right? Just I'm coming to that point also. But if you talk about the food also, the use of growth hormones, we know this thing is very well. So these are the different sources that proves that every second your body is getting toxins. Day by day, every second, you are taking toxin into your body. So how to remove that? Is there any other way? Is there any way? If we see anything which is not suitable for our body outside, we just take bath, we remove this, we wash our hand and everything. What about the internal thing? This. So we came up with a solution and we came up with a principle that is shown. So I will tell you about those things. But can you believe that these toxins is leading to something else? The toxin day by day, every second we are taking, and these toxins is we have leading in the diabetes. India has become the diabetic capital. And if you remember Dr. Linus Pauling, he stated only one thing, that all diseases are with the toxins accumulations. Right? So diabetes is the number one killer right now. Now, second one is the heart disease. Right? Day by day, if you see, the 11% chances has increases. Every year, so many people. Right? But mostly, if you see, the mostly death occur because of the heart. Mostly. And the third is the, like, becoming in the top 10 list is the cancer. Can you believe? Every year, 10 lakh people, 7 lakh people every year, they are diagnosing cancer, and 3 lakh people dying with the cancer. So these three, if you talk about diabetes, heart attack, cancer, these all are coming with the basic root. If you talk about the basic root, that is the toxins we are getting every day, every seconds. So the seriousness of this disease demands something to be done with our body. So Kelling came with a principle, and that principle is very simple. We called it ABCD concept. That is, if anybody can do. If you talk about, like, this is the very simplest concept approved by the WHO. Like, first we need to clean our body. Why to clean? Because if you see that toxins is going inside your body, right? You need a process, that is detoxification process. You must internally clean your body. And how does the disease happens? So because of the imbalance of this anything, either excess of nutrition or less of nutrition is causing the disease, right? So balancing is very, very important. Maintaining your pH level in this daily hectic lifestyle is very crucial, right? And if you do cleansing in your body, if you do balancing in your body, then the activation will automatically happen, right? Your cell need energy, your cell need pure blood, pure oxygen to supply, right? Then your every cell will get regenerated. And if your every cell is active, then your defending power, that is the immune system, will automatically boost up. So this is very simple concept, right? Which we are talking about, and past 26 years, we are telling to the whole world, and people have accepted this thing. And Kelling brought how you can do cleansing, balancing, and activating and defending. So with this thing, but let me tell you about our product. First, there is no side effect of any Kelling products. Right? Second, we are unique, right? Chlorophyll, we are having the monopoly in the whole world. Nobody other can bring this chlorophyll, alpha chlorophyll. Third, our products are very natural, and of international standards, right? And testimony, my God, if you go to the testimony sections, you will find lots and lots of testimony across the world, right? The world had accepted our product, and we are marketing more than 2 decades, right? So let me introduce you our mother product, that is chlorophyll, K liquid chlorophyll, right? We say in Hindi, if you talk about, we call it a Ramban, right? Because if you take chlorophyll every day, past 23 years, me and my family, we all are taking chlorophyll, and touch wood, in these 23 years of this health journey, right? We have not taken a single medicine. Not even my father, not even my wife, not even my children. Nobody has taken any single medicine. Right? Just why? Because we have built up the immunity system. So if you talk about this chlorophyll, the main function of this chlorophyll is the three. It will do all this cleansing, balancing, and activating. It will do all the three works in your body every day. If you take chlorophyll, so you are balancing everything from the morning, right? If you talk about chlorophyll, the main source of chlorophyll is the alfalfa. Alfalfa is a plant, is an Arabian word, which is you can say the father of all food. So the main source of alfalfa, right, chlorophyll, is we take it from chlorophyll. It is of three colors. One is green, one is like a little bit whitish color of white, and third one is the blue one, right? And the best part of this chlorophyll that it derives from this blue part of this alfalfa, right? And alfalfa, if you take chlorophyll, right? So one scoop of chlorophyll, 1 tablespoon is equivalent to taking 1 kg of fruits or vegetables. The nutrition you get from the vegetables, right, that is equivalent to 1 kg, right? And that is, if you take one scoop of chlorophyll, that is equivalent to, you will get the nutrition, all the essential nutrition. I come up with this thing, right? Because our body needs food. Our body needs only two kinds of food. One is acidic and another one is alkaline food. Right? If you talk about alkaline, all green vegetable and fruits are alkaline. But if you talk about acidic, apart from green vegetable and fruits, whatever we eat right now in our daily lifestyle, that is acidic. The science is saying is what? That you need to have 80% alkaline food and 20% acidic food. But if you check our daily lifestyle, the whole day from morning till night, we are eating only acidic food. There is no place of alkaline food in our body. We are not taking any alkaline food. Can you imagine that? Because now the ratio becomes like 2 kg of, if you eat 2 kg of green vegetable or 2 kg of fruits, then only you will be able to maintain this ratio. And we are not maintaining that thing, right? From morning till night, what we are eating is like morning we take tea and biscuits, that is acidic. We take chapati and vegetables, that is acidic. In the lunch, we eat rice, fish, everything, that is acidic. In the evening, we eat mudi tile bhaja, that is also acidic. In the evening, we take chapati and vegetables, that is acidic. So we are not unable, public is not able to maintain their pH level. So we come up with this thing that if you take chlorophyll every day, what chlorophyll will do? If you see, the scientists found only one thing. If you see the molecular structure no, of the RBC and chlorophyll, both are the same. Both are the same. The only difference is in the center of chlorophyll, there is magnesium. That is why its color is green. And in the RBC, in the center, there is iron. So the color is red. So chlorophyll, we can use chlorophyll as a pure blood in the body. Can you imagine that? Right? And it helps to regrowth of the new RBC. It increases the RBC. Very fantastic natural products we got. Right? And the very simple thing, if you talk about, is the very simple thing is that if you take chlorophyll every day, you are cleaning your blood also. And chlorophyll, if you see, it's rich in zinc. Chlorophyll is rich in zinc. Natural form of zinc. Right? That will boost up your immune system. And with the vitamin A, if you include with the zinc, right, your skin will glow up. And the second, the natural form, you will get the selenium, right, which will give you energy all the time. Every time you will feel, very energetic, right? After selenium, chlorophyll has vitamin E, anti-aging properties. If anybody can guess my age, what would be my age? I'm looking at least 10 years younger than my age. Because past 23 years, every day, every single day, we are having chlorophyll. Natural form of vitamin you will get. Then vitamin C you will get, right? Which will make you alert. Now I know so many people by seeing or looking to this matter, right? They are getting sleepy or they are doing something else, right? They are not able to pay focus, right? Vitamin C, start taking vitamin C. Then vitamin A also, right? That will strengthen your heart function. So many things are available. You guys are expert in that. You will understand what the chlorophyll can do miracle in your body, right? But let me tell you one thing. Who should take the chlorophyll? Why we are suggesting, right? We are asking everyone to take chlorophyll, right? That like the skinny people, they should take chlorophyll. Those with the constipation problem, they should have the chlorophyll. Those with the menstrual pain, like leukorrhea, menstrual disorder, whatever may be the problem, you should have chlorophyll, right? And those who eat out often, like we doctors, we never eat on the time, right? So we should have the chlorophyll every day, right? Those with the pale complexion, they should also have, right? Those who are heavy smokers and alcoholic, right? If you ask any alcoholic people that to quit alcohol, he will never quit. What we say that, okay, you want to drink, you drink. Night you drink alcohol, morning you drink chlorophyll. It will do balancing, right? And those with like those who cannot stand cold, right? They should also have chlorophyll. And those with the body odor or mouth breath problem, right? They should also take chlorophyll, right? And if you don't like eating vegetables, no need. More early morning, wake up, empty stomach, take 1 glass of water, add 1 scoop of chlorophyll, drink it, bas, finish. You don't need to take the whole day thinking about the taking vegetables. Those with the weight problems, right? People with the weight problems, right? They are getting obese. They should also have chlorophyll, right? Those are very busy and very stressful people. They should consume chlorophyll, right? And those who are fatigued, who very easily they get tired. Morning they start with their full energy. Afternoon they are fully tired, right? They should have chlorophyll. And those with the liver problem, respiratory problem, like rheumatism also, right? Even the anemia, right? It will help, right? And even the people with the sore throat also, they should also have the chlorophyll every day, right? If they take chlorophyll, that thing will also go, right? And now, if not only the internal part, chlorophyll can be applied outerly also. In my career of 23 years, I have applied with so many of wounds, right? There is a book of Dr. Vernon which says the healing power of chlorophyll, right? If you read that book, right, even in our childhood also, whenever we have any wound or any cut, we used to do like some leaves and then we put it on the cut or wound. We do. That is chlorophyll. And here, if you can see, I'll tell you one example. When my daughter was very young, she fell from the bed and she has a huge cut under the eyebrow. She has a very huge cut. It is the incident of in the Saturday night. She got this thing. Doctor came and he said that we need to stitch. There will be 8 stitch in her eyes. We said, okay, no need, because we have chlorophyll in our home. Chlorophyll is a very good painkiller also, right? We applied only chlorophyll to her. You can see, right? The skin started repairing itself, right? And if you see in the Tuesday morning, right, this is the picture. Saturday night, it started. Tuesday morning, it's gone. Now, nobody can see and they say that, okay, your daughter has this problem. No, it is totally gone. Even my younger brother, right? We are Marwadis and we know, this thing you can see. So we are Marwadis, right? On Dhanteras, right? He was just putting something and one big glass fell on his head. It was a very deep cut. Doctor said we have to cut all the hairs and we have to do like that. We said, okay, no issue. We have chlorophyll. We started this thing, and on the day of Diwali, you can see there is no wound. Even the patient with the gangrene, you can apply chlorophyll with the gangrene patient. I have cured so many people. Doctor, when they go to the doctor, doctor said, okay, you need to amputate it. But there is no need to amputate, right? If you apply chlorophyll, wash with the chlorophyll, apply chlorophyll, right? The gangrene will also slowly start getting recovery, right? Even the chlorophyll is so beautiful product that the basic thing is this, it reduces temperature also, right? Body temperature, maintaining very well the chlorophyll. And the motto of this thing, our main motto of regarding the chlorophyll is very simple. This thing that our Nara, you can say, our motto is to like every house should have chlorophyll. Har ghar ek chlorophyll. Right? Every house should have, because the people who is breathing, who is drinking water, who is eating food, he should have chlorophyll. You should have chlorophyll, because there is no other way by which you can maintain your body pH level and this thing. right? So this is our very motto. And the second products which I'll talk about is the K-Flex, right? That now in the early segment, Babita ma'am has clearly mentioned, and Babita ma'am have given you the latest research on this flaxseed oil, omega-3 and omega-6. Like past 23 years, we are selling this thing, and the K-Flex, all you know, right, is very, very important, omega-3 and omega-6 fatty acid, right? And our body is not able to produce omega-3. We have to supplement it from the outer source, right? So for this, we are selling this K-Flex. K-Flex, all the benefits which Babita ma'am have stated you earlier, right? Only the small information I can say, able to share you, right? In every dosage is 1050 mg, right? In our one capsule, you will find 350 mg. If you take 3 capsules of K-Flex, it will finish. Your daily job of omega-3 is finished, right? First 100 days, when a person is newly starting, we go with the weight, right? That is above on 15 kg, we say take 1 capsule. So if a person is of 60 kg, you recommended 4 capsule. If a person is of 75 kg, you recommended 5, right? According to that, after 100 days, every day the dosage is 3 capsule. If you take 3 soft gel, that is good enough for the people to relax, right? So this is a very small thing because Babita ma'am has already told you about this thing. So this, the omega-3, the K-Flex contains ALA. Babita ma'am talk about the ALA also, right? It has vitamin E, right? Omega-3, that is fantastic product, the K-Flex. And but we can say that people have started. If I talk about myself, way back in 2002, right? I almost completely lost my eyesight, right? So if you can see, there is a cut mark in my head. So I have lost my eyesight, and my eyes vision was very poor, very poor. This right eye was of the 0% vision, and the only left eyes only 10% vision. I'm sharing my testimony why I started this company, right? I went so many doctors, right? So many doctors, even abroad also. They are saying only one thing, right? Yeah, there was a problem of keratoconus. So they said only one thing, that whatever the life you are having, only 1 or 2 years, within 1 or 2 years, you will be completely blind. So one of my friend, he came and he introduced this chlorophyll and K-Flex to me. And he said, you please start using this thing, right? Nothing will happen, no problem. But at least you should try. I tried. After 3 months, I'm telling you one thing, right? I was in my factory, and when I coming out from my factory, right, there were some children playing, so I was not able to see them also. So I fell down, and the worker, they took me and sit me on the chair. Then there I broke my lens also. So then I was sitting and I realized that something is clear. Then immediately next day I went to the hospital and I checked myself, right? In this earlier, it was having power of minus 13.5. Minus 13.5 power. But now the power is minus 3.5. The vision is 80%, and in this eye, vision is 100%. Can you imagine? Now, without the spec also, I can able to drive, I can see, I can do my work every day. Right? So you guys are nutritionists playing a vital role in the society. Right? That nutrition plays a vital role. I learned only one thing, that if given proper food to the cell is bound to go back to its basic nature. Right? So we are dealing with the foods only. So let's join our hands together and let's see what miracles we can bring. So whatever the time you have given me, so thank you all of you for your valuable time. So now over to Mr. Subel.
Thank you so much, Chandalia sir. And now are open for question answer. So if any audience have any questions, just sir, I want to ask you that is it available also in capsule form, and which is more potential, the liquid one or the capsule chlorophyll, or
Chlorophyll.
uh, huh,
Chlorophyll is always better in the liquid form. Right? There are so
liquid
many
form?
things, so many chlorophyll are available. One is that is of wheat grass, not alfalfa. because alfalfa we have the monopoly,
You have
right?
the patent of alfalfa.
We have the patent, so only we are dealing in alfalfa. Otherwise, after in the market, if you see, you will find wheat grass chlorophyll, right? That is in the powder form and in the capsule form also.
So you have powder or liquid one, or both?
Liquid one, very liquid one.
Liquid one. Now you are
Yes.
saying that you have to add one scoop in one
One
glass.
glass
So
of
that's
water.
why.
Water.
So and it is the liquid.
Yeah, it is a liquid. It is in the liquid form.
So many children are also not taking vegetables. The parents used to complain. So at what age we can introduce, or at what doses we can introduce chlorophyll for the
Okay, if you talk
teenage?
about the children or children, very infant people, when they start eating, right, after 2 years or 3 years, you can start, you can give. Like you can give from the first day also. Right, in Japan, one of my friend, Takasute, right, he uses on his 1 month baby also.
Very
Right,
great.
so,
But at least we
uh,
can start at the age of 2, 3 years when they become very much fussy in eating, or they are going to schools. So at that time we can start. But
that time
obviously
we
we
can
cannot
start,
give.
and when the mother is pregnant, no, you should have chlorophyll. You should have chlorophyll. Why?
There
Because
are
I'm telling
studies
you,
for a
if you
pregnant
talk
mother
about,
also.
because we need some iron supplementation there in that time also, right? And that iron supplement, if you talk about like I'm telling you by the very clearly the Renbexy, right? If you take iron supplement, what will happen? The constipation will occur, right? Constipation. So the Renbexy company is very smart. What does the company does? Or they have just put the glycerin inside it. So the bowel movement become easy. So people think that we don't have the constipation, but the actual constipation remain the same way. Right? So why to do this? I have 2 children, right? And during pregnancy, my wife not use any single medicine, right? We went with the chlorophyll and K-flax and spirulina, right? That is the best combo, natural this thing, right? And I have 2 babies, both are natural delivered.
But for the pregnant woman, do you have any studies for that we can apply to the pregnant women, or as this group is very much vulnerable? So, uh,
No issue. I will share all the studies with you. That thing,
so that is a good
right?
thing. So, and even for
I
the
will share.
vegetables, those who are not
Ah,
taking vegetables, they will get the antioxidant. But obviously, for the fibers, we have to meet from the other source. Fibers, for which.
fiber we can. We have to like from other source also.
Okay, Babita ma'am, are you there?
Yeah. Tell me, Shomendu. Thank you.
Uh,
It was a
uh,
lovely presentation.
yes, yes,
Thank you, ma'am.
it is very lovely. Ma'am, we cannot see you. Your video is on or
You
not?
okay? Sorry.
Okay,
Okay.
so any other questions
Okay.
anybody has in their mind?
Anybody has any questions? Ma'am, I want to ask you about the inflammatory oil you have mentioned. Almonds. Many people used to take almonds every day in the morning. These are also source of omega 6, whereas
Adil,
walnut is.
can you be a bit louder, Shomendu?
I am telling about the ratio of omega 3 and omega 6. Many
Okay.
people unknowingly taking the omega 6 more in amount in from the
Huh.
nuts or oil like sunflower oil or
Yeah.
almond nuts.
Mhm.
So what will be the ratio you want to mention?
Omega 6 to omega 3, it can be 1 is to 1 or 4 is to 1 to be in the right way. But we see that most of the diets, especially, because people are getting westernized, people are taking, food from outside, ordering heavy, okay? And there it is seen that omega 6 to omega 3, it has even gone up to 40 is to 1, which is dangerous. So 4 is to 1 is okay. It should be around 4 is to 1, but also 1 is to 1 also it could be fine. Omega 3, omega 6 to omega 3.
Yes.
Great. So any more question, Babita ma'am, you want to ask?
Maybe
Or
since we take the opportunity here, Mr. Hansraj, since you are into physical training, because these days, like we find that people, they are prescribed a lot of proteins. Though this is not, we are not talking about proteins and chlorophyll, because you are here. There is a heavy
Okay.
prescription of these whey proteins. So, what is your take on that?
in
See,
the
whey
gyms, as
protein
we
is,
gym trainer are supplementing these or prescribing over the counter to take too
Yeah,
much of
even over the
protein and
counter.
all that.
it depends, right? It depends of the person fitness, that how he wants to get himself fit, right? But if you take whey protein, right, the ideal ratio is to like a body weight of 1.5 to 1.8 or up to 2, right? Not more than that. The daily requirement of protein is 1 kg, 1 gram, right? That is the daily requirement a normal person is should have,
Normal person.
right? But if you go to the gym and if you want to build the muscle, the ratio increases from like 1 kg is 1.5 to 2 gram of whey protein, right? But whey protein is, whenever I'll suggest only people one thing, that if you buy any whey protein, don't take it like with closed eyes, right? If you should check the lab report also, right? Because so many companies are, they are claiming so many things, but that is not available in the box, right? So go always check the lab report also, right? Even the nowadays, like the pure form of protein they are producing, like the whey protein, right? They are giving their barcode also, so you do before taking that you should scan. But the if you don't, you can easily like if you have chicken, if you have fish, if you have egg, right? And in vegetable source, if you talk about like if you have soya chunks, right? And then if you have like paneer, if you can like go with the lentils, right? It will cover up, right? So supplementation
But
of
it's
whey protein is
amount.
important for the athlete kind of people, right? For the athlete kind of people, if but if you are normal, if you are not doing any activity, you want to stay healthy, right? At least just try to maintain 1 kg per body weight, like 1 kg to 1 gram of whey protein.
Indrajit, do you want to ask any question to start?
Yes, can I ask a question, please?
Oh, Nina ma'am,
Yeah,
Uh,
yes.
sure.
I
Go
want
ahead.
to know, is there any expiry date for chlorophyll? How long can it be kept for?
Say, like as for the IUs we are concerned, right? They allowed us for the 3 years of expiry date, right? There, because apart from if we don't put the expiry date on that, so they are saying that their royalty will not generate. So if you see about the chlorophyll, when the powder form is get stuck and the water comes up, then it's expired.
What about the liquid form?
Liquid form, if you talk about, like we have 3 years. Right.
Three
After
years.
that, chlorophyll don't, 3 years, chlorophyll don't expire, but the pH value of that chlorophyll, right, that will come every year. We have what our research has said that every year it is reducing by 1. Right.
Okay.
Suppose now we are selling it 14 pH level chlorophyll, right? So every year 1 pH will be down.
Okay. Thank you.
Ah,
Thank you, ma'am. Any
Hi, sir.
questions from the? Yeah.
Yes, from my end.
Yeah.
When I was going through the chlorophyll studies in my MSc, the bioavailability of chlorophyll is not very much. So even though you are consuming chlorophylls or chlorophyll-rich vegetables or whatever, it's not getting absorbed in our body. So is there any particular formation or is there any particular active component that is being used in your product?
See, basically, when if you
Bye.
take like if you supplement the chlorophyll with the vegetables, no, if you want to complete this chlorophyll with the vegetables, right, your digestive system has to be very strong, right? Then only it can be like able to like separate the chlorophyll from the leaves or from the vegetables you eat, right?
Yep.
What we are doing is this. What we are doing is this. Like it takes 42 kg of leaves, alpha leaves. If you talk about alpha leaves, we take 42 kg of alpha leaf and then we put the needle in the cell where the chlorophyll is stored. As we know, the electron, proton, neutron. So where the chlorophyll is stored, out of that 42 kg leaves, we just taking out the chlorophyll, right? Only 5 ml.
Okay,
Only,
understood.
only 5 ml. So 5 ml chlorophyll, which is like completely purest form of chlorophyll you get. But I'll tell you a little bit about the manufacturing process of also. Because if you take out chlorophyll from any process, right, it will be like color will be gone. So what we do, we took out chlorophyll from the leaves and then we separate the magnesium first. We have to separate the magnesium. Then we have to put it in the liquid form. Then after at the end process, there are 14 different kind of process. In the last process, then we all again include the magnesium so that the color remains the same, the green color.
Okay, that's nice. And
Yeah.
also, I had one question because of the whole protein topic came up. So recently, the whey protein prices has gone up too much, and a new product has came into the market, which is the fermented yeast protein. And what's your views on that?
See, if you say only see the content on those, right? I told you very clearly about this thing, right? So many companies are available and they're claiming so many things. If that product has the lab report, go and check the lab report, right? And if your this protein shake, right, that is every in one scoop, they are claiming from 25 grams to 35 gram also. So many companies are claiming this thing, right? So to go and check, find out that whether they are actually saying the same thing, that the protein is available there or not. First thing is this, and then second is the gram I want to take, right? If I can take 4 eggs a day, suppose my body weight is 60 kg, for example. So how much protein I should take? If I want to remain healthy, 60 gram of protein is good enough. Egg contain 6 gram. So if you take 4 eggs or 2 eggs, 4 eggs, 24 grams protein. One meal, good enough, right? And if you take 200 gram of fish, so 100 gram of fish is containing 25 gram of protein, right? So if you take 200 gram, that is 50 gram. So 50 plus 24, 74 gram, finish.
I think the
You got my
fermented,
point?
this fermented yeast protein, which is coming up now, I think it is easier on the stomach than the way, because some people may have
because they
bloating.
are bloating because of this, because they are very lactose intolerant.
Yeah, because if
Right.
there's some amount of lactose in there, so in that case, this yeast, fermented yeast, may be a better choice. But I don't know what is the price, because price is also a factor. I don't know what's the price of
factor,
that.
very important factor, price actually.
Yeah.
Right, where the protein source is easily available in our daily diet, right? Especially for the non-vegetarian, it is very cheap. Right, so when easily that thing is available, right, no need to go for the supplement this thing, right? Because in the long-term use of whey protein, if you are not an athlete, right, so bloating one thing will happen, and second is like it has a very danger effect on your kidneys also.
I have one question to Babita
Sir?
ma'am, that essential fatty acids are very important, but can you hear me? I am saying that essential fatty acids are very important, but how can we check in our blood parameters? For the audience, I am asking this question to you. Deficiency.
EFA values, you can get it from the blood test. Okay, so the values for the infant, I mean, there are the total, the omega 3 for a baby, it is 0.4 millimole per liter, it is the normal. But for a person of 1 to 17 years, the values are 1.1 to around 0.5 millimole per liter. And for the age more than 18, that is for an adult, it is 0.2 to 0.5 millimole per liter. And in case of omega 6, less than 1 year is 0.9 to 4.4, 1 to 17 is 16, it's 1.6 to around 4.7, and for an adult it is 3 to 5.4. And in the case of the total fatty acids, if you talk about, the reports are, I mean, the test values are, the reference values are 3.3 to 14, 1 to 17, 4 to 14, and above 18, that is for an adult, it is 7.3 to 16. So by this, you can just find out, if it is in the reference range or not.
This is great. People should go for this because we always go for vitamin D3 test nowadays, but we should do this. There we can understand if there are any deficiencies or not, right?
Yeah.
Good. Thank you.
What were you saying? Deficiency?
I am saying that it is good to test the test because we are doing vitamin D3.
That's what.
It is now Nowadays, all the doctors are asking for checking the vitamin D.
Everyone is doing vitamin D3, true.
So, but we are not doing this omega-3 or essential fatty acids. So, what
That's
is
what,
the name
because
of this? What is the name of this test you were suggesting? Just asking for the serum
essential fatty acids.
essential fatty acids.
Yeah, and if you see the people, the deficiency symptoms, you need to look into what you need to also know what are these the symptoms of this EFA deficiency. Okay, mostly there'll be hair loss may be there. Okay, there may be the dryness and the scaly skin. Okay, the skin becomes scaly, especially in the elbow part and then the back of the arm, and there may be also dermatitis. So problems like small pimple type of thing in the back of the arm. So this is one of the deficiency symptoms of essential fatty acids. Okay. Okay.
Okay.
Anything else?
Okay. So,
So if you
anything
don't have
else?
any, so we have to close. It's already a great session, great new learnings, and more than 70 people have joined when we have started. So people have started leaving. Any question in the chat box? Can we see? There is one. No question in the chat box. Any audience, any dietitians, do you want to ask anything to the experts, or we will wind up?
Thank you, Soumyendu.
Okay,
So
so it
thank
was
you
a great
so
session,
much.
all because of Babita ma'am. And Soumyendu sir, you have done a fantastic job, right? As an MC, you are the best. Thank you very much for giving your valuable time. Thank you.
Thank you.
Thank you.
Namaste.
Thank you.
Thank you. Thank you, Soumyendu.